everyone. My name is Nicole Horn. I am the Managing Director of Third Edge Coaching and Consulting, and I am here with Dr. Sam Craig, who we are going to have a dialogue around addiction and mental health. Dr. Sam, give us a little bit about your background.
I have a diverse background. I have a lot of years experience in education as well as in substance abuse. I started working in substance abuse in 91 when I first went back to finish my bachelor's degree. I had pretty much dropped out of college and I wasn't satisfied with the type of work I was doing, and I was living in Alabama. I moved back to Michigan, and I needed a job while I was going to college. And a friend of my sister's actually was the program director for our outpatient substance abuse treatment facility, and I started working there. In an entry level position, doing intakes and so on. And I caught on quickly because my neighborhood that I grew up in, I was familiar with drug abuse and seeing people addicted to drugs. And so I caught on quickly and moved up through the ranks. I was a recipient rights advisor, a clinical supervisor. I became a program director. And while I was working on my master's in counseling, I ran into a former teacher of mine. And she asked me to come and do some work with some young people who were having problems with gang violence and so on. And I did a television special with Easter Seals that year, working with kids in Highland Park, and ended up changing from counseling to educational administration. I didn't leave substance abuse. I continued to do substance abuse counseling, and I continued to matriculate through the education system in terms of becoming an assistant principal, a principal, college administrator, and now I'm a college professor and a clinical director.
Well, I want to hear a little bit about your newer venture, the Diversified Concepts in Counseling and Consulting. Can you talk a little bit about that, please?
Sure. And Diversified Concepts is really not a new adventure. It's something.
Newer.
I started this probably at the end of the 90s to do my own counseling and different projects. I found that there were different needs with young people as well as with substance abusers. So I was going back and forth. And more recently, when I moved to Georgia in 2016, I started working again in substance abuse. And I would contract with different medical professionals to provide their patients with counseling, especially those that were addicted to benzos and opiates. And so I came back into that field in terms of being a director, a program manager. I'm a clinical director for outpatient substance abuse treatment facility now. But in my business, we were working with private providers. And so I've gotten together with a couple private providers, and we're doing our own thing in the for-profit world to provide outpatient opioid treatment to those dependent on opiates.
So this part of this, I've known you and gotten to know you over the last few years, and you are constantly in service to the community. And that's, I imagine, part of the driver. Can you talk a little bit about how your efforts are impacting the community and why it's important?
Well, people look at those who end up dependent on opiates, and they develop a lot of preconceived notions. There's a thing where, in general, people would give money all day for programs that benefit women and children. They are a little more hesitant when it comes to ex-offenders and substance abusers and so on. And I don't think that people really understands the dynamics of how deep substance abuse goes. If I were one that was dependent on some form of drug, I would be taking resources from my whole family.
Yeah. Yeah.
And so it not only affects me directly, it would affect my children, my wife, if I had one, until I drug everybody down or until they kicked me out of the family, or so on. One of the courses that I started teaching 10 years ago, um, it was taking sides. It's about drugs in society. And so when we think about the person that's abusing drugs, we don't look at the overall effect that substance abuse has on the community. And by that I'm talking about everything from kids putting into the system, foster care,
Yeah.
people who
Yeah.
lose their children. And if we just look at the impact of the crimes that are committed to sustain a substance abuser, in itself, it does tremendous harm on the community. And I was thinking the other day, I was listening to a patient who was using like 350 milligrams of Percocets a day,
Oh my gosh.
which is expensive. You know, now this person has no job, no means of supporting it, and he's dragging the young lady down that's trying to help him make it.
Yeah.
But what people don't understand is if his habit dictates that he have $100, $200 a day, he don't get Sundays and holidays off. He has to have these drugs every day. And so there's nothing that they won't do to get these drugs, from, becoming a sex worker to crimes,
Yeah.
shoplifting,
Yeah.
and a lot of things like that. And that's all a drain on the community.
Yeah. I mean, you're
And
talking about the impact on kids, you're talking about the impact of crime, you're talking about the impact of that person being unable to work. It's a ripple.
it is, it is, and him not working is the biggest thing, because that means those of us who are working, we come out and our rims are missing off our cars are
Yeah.
stolen. We pay a price for this person's dependency. And when I first started working in substance abuse back in the 90s, you could really identify the addict. You
Yeah.
know, most people then that were addicted to heroin, or something like that, codeine and things of that nature. Now we have more and more people who are addicted to pain medicine. So you can't tell the addict anymore. The housewife,
Yeah.
the high school athlete that injured himself and they put him on pain meds. People don't know some of these drugs are so powerful that just, going to the dentist and getting oxycodone from the dentist, in 3 days you're addicted to this because of
Yeah.
the amount they're giving you. You get these high doses, and if you take it like they prescribe it, 3 times a day, every so many hours, for 3 or 4 days, by the fifth day, if you don't take it, you notice you sniffling, you got diarrhea, you having withdrawal symptoms. So the addict, what we perceived as the addict or the person that's addicted, has changed. What I see a lot is persons get addicted to painkillers, and painkillers are extremely expensive, and it's like a class. It's a higher level of addiction when you're addicted to pills and so on.
Well,
But it doesn't.
No, go ahead. Finish. You
but
finish.
it doesn't take long for an individual that's addicted to pills to not be able to afford pills at $200 and $300 a day. And what they will find out is that heroin will do the same thing at a much cheaper cost. So now you got a suburban housewife in an urban community looking for a cheaper drug to maintain an addiction.
So we are seeing the rise of opioids in pain management, or have seen that. Can you talk about that a little bit? What you are seeing of the use of opioids in pain management, and is that what's gotten us here?
It's kind of difficult to say what's gotten us here. You know, it's like what comes for first. You know, um, as a society in general, we are what they used to call a microwave society. We want everything fixed right now.
Yes.
We don't do pain. If we have a headache, we need something that's going to move that headache in less than an hour.
Yeah.
You know, and so it's the same thing when you have some type of physical ailment. Most of my patients now have experienced some type of knee injury or back injury. Back injuries, there's so many people
Yeah.
who end up addicted because back pain is like a chronic issue and it's ongoing. And so, you know, as soon as they feel that tweak, they pop a pill.
Yeah.
You know, and it doesn't take long to get addicted to those pills. And so, how did we get here is kind of difficult. You know, is the question is, you know, whether we are so afraid of taking a little pain that we pop a pill first, or having, you know, big pharmacy take advantage of our desire not to feel pain and say, here, take this. Um, as when I was a principal, I think no, I'm certain I've had 5 shoulder surgeries. And my second shoulder surgery, when I woke up out of surgery, I had a morphine drip going straight to where the surgery occurred, where they repaired the rotator cuff. They also gave me a 3-month prescription of Vicodin and oxycodone. And because of my background, I refused to take it.
Yeah. Yeah.
Well, they were kicking my butt so bad in therapy, you know, I was in so much pain. I took one oxycodone once and I was so high. They laughed at me the whole day in therapy. I would not take it anymore. I just deal with the pain until I got over it for the other surgery. And if Motrin didn't do it, I just wasn't going to do it.
All right, so I grew up during the era of just say no. Just say no, Dr. Sam. Talk to us a little bit about that as why that is a failing strategy. Unless you disagree and think we should think more about that, and what you think is a better discussion for us to be having to be encouraging people to choose a little bit of pain over possibly a lifetime of addiction.
Just say no just takes out a lot. It, it it takes a lot of things that should be considered out of the question. And there's so many variables here that it's hard to just tell somebody just say no. I think the message should be is to be aware. If you know that there's a high chance of you messing your life up and everybody else's life, you'd be a little more cautious. Maybe instead of taking that prescription 3 times a day, you might take it once at night so that you can sleep, and then cut it off as soon as possible. So I think the main thing is to have people educated and aware. The other part of it is Doing the just say no thing, there was a such thing as a gateway drug. There used to be a pattern where, we tell kids, if you smoke marijuana, cigarettes, and marijuana, these were gateway drugs, and they would lead you to being in an environment where you were exposed to other more harmful drugs. There's no such thing anymore.
Yeah.
All of them, it's like you're taking a risk with everything. With fentanyl on the scene and people trying to make money,
Yeah.
they've decided to mix fentanyl in with everything because if I could get you hooked on weed with fentanyl, cocaine with fentanyl, I got a customer forever, until you OD or go to jail or something trying to pay me. So just say no would be wonderful if people could just say just say no. But we just have to make people aware of the risk that they're taking, and the consequences are more severe daily. The
Yeah.
things I experimented with, there's no way I would want my 16-year-old experimenting with them now because you don't know what you're getting
Yeah.
at any time.
We have come to understand that opioids are just so much more addictive. Can you talk about that and the addictiveness of the opioid drug?
Well, we're talking about different levels of drugs. If we're talking about street opioids like heroin and so on, there's always a question of the purity,
Mm-hmm.
the amount of heroin or the amount of cocaine in the drug. And these drugs are often cut so severely to increase the profit margin that even though they are addictive and destructive, they're not as addictive as some of the prescription painkillers.
Interesting. Interesting. I think that's something that most people don't realize. I would not have known that.
Yeah, well, when it says 25 milligrams, 30 milligrams, that's what you're getting.
Yeah.
So
Yeah.
even though you go and pay $50 for a blow of heroin, you don't know whether it's 10 milligrams or you taking a chance. But when you get a Percocet or you get oxycodone, you getting that same strength that the manufacturer has put on there every time. And then the other thing people don't realize is once your body gets used to an opiate, you cannot reduce the amount that you're taking and just stop, not without physical pain.
Yeah.
Um, the body develops a tolerance, and so it causes the body to need more and more over time. And so, my $100 a day habit today, my $100 a day habit might be $100 a day today, but next month it may be $150 a day.
Yeah.
So whatever I'm doing to support this, I'm gonna need to increase it on a regular basis. And then you have people who are trying to help individuals that are addicted by paying for it, this, that, and the other, and they don't realize that that's not really helping them in the long run.
Well, that brings me to what are some of the misconceptions about around opioids and opioid users that you regularly see when you're out talking about this topic?
Well, I don't know that there's as much misconception about the opioid and the opioid user as there is about some of the treatment modalities for them. A lot of people have problems with treatment um, modalities such as methadone, Suboxone, Sublocade, and so on. And they consider that the individual is trading one drug for another.
And what do those drugs do? Those things that you just listed, what do they do?
Um, Suboxone has like a blocker in it.
Okay.
And so with Suboxone, the person that's on Suboxone, first thing it does is it makes it so that the individual can function. They don't get sick if they don't have the opiate.
Okay.
So they're able to function normally.
Yeah.
But it also has a blocker so that if they try to get high while they're on it blocks the chemicals that would allow them to get high. Methadone has a little more potential for abuse because um, while you can get a blocking dose of methadone to block the opioid that the person is using, you can't get a high enough dose of methadone to get high.
Mm.
And so persons have been known to divert their methadone, to sell it, fake that they're addicted to opioids to get methadone to sell, and so on. So there is some abuse potential. But the main thing is that these drugs used correctly with medical supervision allows an individual to function normally. It's like giving a diabetic insulin.
Yeah.
You know, it keeps them from being sick and gives us as clinicians an opportunity to work on their psychological addiction.
Yeah.
Theoretically, we can um, I have to pick my words carefully. Theoretically, I used to work for a doctor in Michigan who created this program where they would um, help opiate persons get opiates out of their system.
Yeah.
Over the weekend.
Over the weekend?
Over the weekend.
That's a quick turnaround.
Well, you can give somebody Narcan and get opiates out of your system in a matter of seconds.
That's true.
And so the program had a lot of problems because, you know, people who are psychological addiction is far more powerful sometimes than the actual drug is. And so just getting the drug out of their system isn't enough. We have to work, we have to focus strictly, concentrate on the psychological addictions that persons have. And there's so many of them, you know, from IV drug use to people even get addicted to the activities and rituals surrounding getting high and the environment and their triggers, you know, persons working in the plant, you know, when they hear the whistle blow, that's the time to go smoke a joint, do a pill, to do this, that, and the other. So, you know, we have to work on those psychological addictions also.
Talk to me about, if you can talk about the opioid crisis and what you are seeing right now and what you see as kind of what does the pathway, what should the pathway forward look like?
I was thinking about a lot of this. I think the pathway forward is going to dictate that the government makes some harsh decisions about fentanyl. You know, in my mind, I think persons caught with enough fentanyl, the traffic should be charged with murder of anybody that is passed in that community.
Yeah, I mean, we're hearing about people over and over again dying of fentanyl. I mean, it's not just here and there. I know of several people who have gone to funerals for people with fentanyl.
And the kids are getting it now.
Yep.
I just heard a couple kids in high school that got a hold of some fentanyl, you know, and being a high school administrator, you know, it's like our kids don't believe, the old folks used to say fat meat is greasy. They have to try it for themselves.
Yeah.
And, you know, I've seen the kids go through the phases where they would have the punch bowl parties with the pills and all this kind of stuff. And it's always been something with people who get high and abuse drugs, that the drugs that killed were the drugs they wanted. Mm-hmm. You know, if somebody died off of a drug, people were looking for that drug, and fentanyl is not the drug to do that with. Yeah. And so I think one thing the government is definitely gonna have to make some harsh penalties for anybody caught trafficking fentanyl. The other thing is that at the same time, we need to make some clear opportunities for folks to get themselves together. In terms of providing treatment for a year, if necessary, or more. Often our third party providers want to dictate how long a person should have to get clean. And a person that's been using 5, 10, 15 years not go get clean in 6 months because Blue Cross Blue Shield say, they're
Yeah.
only going to pay for six
Yeah.
months. So we need to have a commitment to helping people get the treatment they need for as long as they need till they can get clean, or get them in a position where they can make a contribution.
Well, as we wrap up this conversation, Dr. Sam, what are any thoughts or pieces of advice that you want to make sure to communicate to people who are watching us today?
Well, if you have young people, you just be aware with young folks. In my house, my wife is the Sherlock Holmes. So, from time to time, she's up there in my son's room and just being, c- helpful while washing his stuff. I'm fussing at her. He's big enough to do his own stuff. But she knows what she's doing. She's
Yeah.
being aware of what's going on and so on. And especially since the pandemic, a lot of our kids have isolated. They spend a lot of time in their rooms by themselves. They spend a lot of time on the internet and so on. And so we need to find out what's going on with them and be aware of their friends, strange behaviors, and so on. The other thing is we have to be conscious as we get older and experience different pains and so on. Some of these pains we just have to experience and keep on moving. We cannot pop a pill for everything that hurts every time something hurts.
Yeah.
You either pay now or you pay later.
Yeah, absolutely. Absolutely. Well, Dr. Sam, thank you so much for joining us. Thank you for listening in on this great dialogue we had, and we hope you'll check out the website to learn more.